A state agency is proposing a Medicaid rule change that could result in Texas families losing at-home nursing. The Texas Tribune published a story looking deeper into this and how it's already causing some worry. The reporter behind this story, Neelam Bohra, is joining us this afternoon here now live. Neelam, thank you so much for being here. We appreciate it.
Thank you.
This rule change that you talked about in your story is coming from the Texas Health and Human Services Commission. Get us up to speed on what that would do.
Yeah, so the rule change is basically taking some of the regulations around certain types of at-home nursing, specifically called private duty nursing, and saying that when a nurse is at home providing services for anyone who is a minor, an adult needs to be home at all times. And the reason that this is tough for a lot of families and causing worry is because there are a lot of parents who work full time and don't spend every minute at home. Even for parents who do work at home, they may run errands, do groceries, go to a doctor's appointment. And this will cause issues for them because this rule is saying they have to be home at all times.
You did reach out to the agency to try to understand why they are proposing this rule change. What did they share?
Yeah, so the agency has maintained that this is a clarification of the rules that already exist. They said this is how that they've interpreted the regulations around this type of nursing since they were first put into place. But a lot of parents have not been following it like this. A lot of advocates have not been following it like this was the case, and that's why you have so many parents who are worried right now.
And your reporting did include some incredibly personal accounts from some of those families who discussed the potential impact this could have on them. What kind of an effect would that be?
Yeah, I mean, there are parents who are working full time, a lot of single parents included. And, they are paying their kids expensive medical bills. They are having to pay for certain things out of pocket. They're paying for insurance. And then they have all the regular expenses a household might have. And so what happens is they really aren't in a position to be able to quit their jobs and stay home if a nurse is at home caring for their child full time. And if they want to keep their jobs, they either have to hire an additional caregiver to be there along with the nurse, which again, a lot of these people aren't going to be able to afford, like one mother I talked to. Or, their last choice is they're going to have to put their child in an institution, something like a skilled nursing facility where they can still receive the round-the-clock care that they need and they're cared for, which I know a lot of families really don't want to do because all they really want to do is keep their child at home.
All right. Well, Neelam Bohra, we're going to have to leave it right there. But thank you so much for your reporting. This is bringing attention to a much-needed issue. We really do appreciate it.
Thank you.